common question people ask when they're considering hiring a home birth midwife is they wonder, okay, so you only take low risk clients. What would happen if during my pregnancy, birth, or postpartum time, a complication was to arise or something went wrong? What would happen? And we explain to them that during their prenatal care with us, we are always screening for signs of complications. So we're screening for gestational diabetes, preeclampsia, we're estimating the fetal weight of their baby, and we're checking their blood pressure, we're checking their amniotic fluid levels. We're always educating our clients too, so they can know between appointments if something was to happen, what a complication would look like, so they could stay in contact with us. And so if something was out of range, something did not seem normal, we would consult with a doctor. And if they did need to indeed have a hospital birth, we would accompany them to the hospital during their birth and serve in the role of a doula. And so we would also give them postpartum care once they were able to come home. So in the birth, again, we're always screening to make sure that the baby is tolerating labor well and the birthing person is doing well during labor. You know, we're checking their blood pressure, we're making sure that labor is moving along nice and normally, that the baby's fetal heart tones are reassuring, and that everything looks nice and healthy. If a complication did arise, a licensed trained midwife knows how to act quickly and handle emergencies. So with birth, when I go to a home birth, I also bring drugs to stop a hemorrhage if that was to happen. I'm trained to recess a baby, so we have equipment for that. We bring sterile equipment, just any kind of thing that you might need during an emergency. When you give birth in a birth center, it's like we have the same equipment, so we basically bring that with us to the birth. And so if there was to be an emergency that could not be handled at home, or something just seemed like it wasn't safe to birth at home anymore, we would do a transfer to the hospital. And most people that have a transfer from a home birth labor to a hospital end up having a vaginal birth. So we always are very conservative, and we only want people to, birth as long as everything is going normal. And in the postpartum time, again, we're always checking to make sure that your baby is transitioning to outside life, outside of the womb very well, that their heart rate sounds normal, their lungs are clear and normal, that they're breastfeeding and gaining weight normally, and that the birthing person's uterus is clamping down as it should, and it's, that bleeding is normal with them. Everything seems nice and normal and healthy. And we do all of this postpartum care in your home. And again, if something was to happen, we would consult with a doctor or a pediatrician for the baby.